Today I will be talking about a basic knee evaluation. A basic knee evaluation is something that should be performed before each time you look at a knee. You got to perform these steps and these tasks in order to determine the severity, the diagnosis, all components that are needed in order to fully evaluate a knee or an injury. The knee is a complex structure that is associated with many different injuries. With this being said, there are steps that one can take to do a basic knee evaluation that should be conducted with every knee injury evaluation. These steps are essential to cover every time an athlete comes to you with an injury, regardless of if you think it is a muscle strain, a ligament sprain, an avulsion, a fracture. Regardless of the situation, you need to perform these tests and these steps. In order to accurately and systemically evaluate a knee, it is important that you follow either the HIPS or the HOPS method. These both refer to types of methods and they kind of interchange with one another. The HIPS method refers to history, inspection, palpation, and then special tests. The HOPS method refers to history, observation, palpation, and special tests. This is the order that you should perform each of your evaluations in order to get a proper diagnostics. The first step to the HIPS or HOPS method is history. This is something that you should sit down and ask the patient. You should probably bring out a notepad or some other form in order to jot down the answers so that you can get a better understanding at the end of your evaluation. History questions help one to get a true understanding of an injury. Helps you determine if the injury is acute, chronic, if it's something that involves clicking, popping, if it's something that's serious, a little less serious, etc. When taking a history, you must look at a series of questions. These questions involve asking the athlete, what were you doing at the time of injury? What position were you in when you hurt your knee? Did your knee collapse? Did you hear a noise? Did you feel a sensation? Was the sensation sharp? Was it dull? Was it achy? Was it tingly? What was the sensation you felt if you felt one? Did you hear any popping? Any clicking? Any light joint slipping? Any grinding? When the injury happened, could you move the knee, or was there paralysis for a minute? If there's swelling present, you need to ask the athlete, did the swelling happen immediately, or did it happen the next day? Ask the athlete where exactly is their pain. Have them take their finger and point to a spot. This can give you a pretty good idea of where the pain is at. Ask them how much pain they're in. A good way to determine this is to have them use a scale of 1 to 10. A lot of times I say 1 meaning nothing and 10 meaning going to the ER. Where is your pain? If you ask this question, you need to be familiar with your athletes. You need to know their pain tolerance because this question can throw you off a little. Another question you need to ask is if they have previous injury to this area. If they do, ask them about this previous injury. If there were surgeries, ask them about the steps, what happened in the surgeries. If there was a previous injury, ask them about what it was, what happened, what rehabilitation they did, etc. The better the history, the better you will be at evaluating the injury. The next step in the HIPS or HOPS method is to observe your patient. You ought to observe your patient walking, squatting, up and down stairs in as many positions as you can observe them to get the best evaluation. In this above picture, we are observing the tibial tuberosity of our patient. As you can see in this picture, the tibial tuberosity is protruding, showing Osgood slaughters, something that can indicate severe patellar tendonitis or another series of things. Other things you should observe when they're coming to you is, did they appear with a limp? Can they flex or extend their knee fully? How's their leg alignment? Are they genu-valgum, meaning that they're knock-kneed? Are they genu-varum, meaning that they're bow-legged? Are they genu-recurvatum, meaning that their knees hyperextend? Do you see any swelling present? Where is the swelling located? Is there any ecchymosis? Or in other words, forms of bruising around the area? Is there muscle atrophy? These should all be observed. It is important to palpate the different structures and landmarks of the knee to check for pain and deformities. You should check both the bony palpations and soft tissue palpations. To make it easier, I break it down into 4 components: the medial, the lateral, the anterior, and the posterior side. When looking at the medial side, I palpate the medial tibial plateau, which is located over here, the medial femoral condyle, which is located over here, the adductor tubercle, which is located down here, Gerdy's tubercle, which is over here, down here, the MCL, which is located right here, pes anserine, located in this area, and the medial joint line, located right here. I then look at the lateral side. Lateral tibial plateau, lateral femoral condyle, lateral epicondyle, head of fibula, LCL, IT band, lateral joint line. Then look at the anterior portion, tibial tuberosity, quadriceps, patellar tendon, the patellar tendon, the anterior joint line, and all poles of the patella, superior, inferior. In the posterior, we're looking at the hamstring group, the head of the gastroc, and the popliteus. Next, we should perform a very basic evaluation involving the different special tests that basically tests the ligaments around the knee and the meniscus in order to check for damage. These are very basic, and I like to perform them with every knee evaluation. The first one I'm going to talk about is the valgus stress test, which tests the M. The valgus stress test is this one over here. Basically, what you do is you take your right hand and place it over the lateral side of the knee. You take your left hand and cup the lower shin. You push the knee with a valgus force, causing the MCL to stretch. If there's an MCL tear, you will see laxity in this area. You should perform this test at 0 degrees and at 30 degrees to check for laxity or gapping within that joint. The next test I'm going to talk about is the varus stress test. This is testing your LCL. This is much like the valgus stress test, except you're going to put your right hand on the medial side of your the knee and your left hand on the lower shin on the lateral side. You're going to push with a varus force, causing the LCL to gap. If you see laxity or pain on that lateral side, then this is a positive test. You perform this test again in 0 and 30 degrees of flexion. The next test I will be talking about is both the anterior and posterior drawer. This is checking the ACL and the PCL. With the anterior drawer, you place the back side of your hands, your forefingers, along the back side of their knee. You place your fingers along the anterior joint line. With their knee in about 90 degree of flexion, you pull anteriorly on that tibia and fibula. What you're looking for is increased laxity or pain as you're pulling in the anterior direction. To test the PCL or do a posterior drawer test, you're going to do just the opposite, and you're going to push posterior on that tibia and fibula, looking for laxity or pain in this test. The next test is referred to as the Lachman's anterior test. What you are doing is you are checking the ACL with this test also. You're putting your left hand on the top femur and your other hand underneath the tibia on the lateral side. You're pulling anterior on the tibia looking for laxity as you pull in anterior. This should cause the ACL to gap if torn, therefore increasing laxity. You have now performed all the components of the HIPS or HOPS method. With this, you need to look at all of the results you have found and therefore make an end decision as to what the injury at hand is.